Welcome to the Gobbet Opus, number 54, the wonder drug that works wonders, from November 10th, 2008. Statins are in the news today for the relatively unimportant reason that they prevent death from myocardial infarction, especially in the subgroup of people who have an elevated C-reactive protein. That's called CRP. C-reactive protein, or CRP, and since it is reactive, shouldn't the proper acronym be CRAP? Is a protein that is elevated when you are inflamed. Many processes will elevate your CRP, from infection to collagen vascular disease, but not being inflamed from religious or political fervor. Inflammation is good in response to infection, but continued inflammation has the potential to cause vascular diseases, and acute inflammation, such as pneumonia and urinary tract infection, are well known to increase the risk of angina, heart attacks, strokes, and pulmonary embolism. Statins also lower cholesterol, but are probably more importantly, statins work as an anti-inflammatory by a variety of mechanisms too complex for my tiny brain to comprehend. What kills people with infections is often an overly brisk inflammatory response. Inflammation is like a fine Bordeaux. A little is good, a lot can kill you. Interestingly, retrospective studies have consistently demonstrated that people who get pneumonia whilst on statins have decreased mortality compared to those who are not on statins at the time of admission. Same result with a recent retrospective study. They looked at 29,900 adults hospitalized with pneumonia, of which 1,372 were taking statins on admission. Quote, at 30 days, those patients taking statins were hospitalized with pneumonia had a 31% lower risk of dying when compared to patients not taking statins. At 90 days, the reduction in mortality was maintained, with those taking statins having a 25% lower risk of dying compared with those who were not on statin therapy. End quote. Bad word, of course, retrospective. What is needed is a randomized, prospective, placebo-controlled trial to see if these results really, truly work. And there have been studies with decreased mortality from sepsis with patients who are on them prior to their sepsis. The epidemiologic data looks good so far, so when you wash down that aspirin a day with a glass of good red wine, include a statin so that when you pass out drunk and get pneumonia, you are less likely to die. The relevant references for this podcast were Chest, 2003, Statins, Inflammation, and Sepsis, Archives of Internal Medicine, 2008, Pre-admission use of statins and outcomes after hospitalization with pneumonia, and a PubMed search using statins and infection as search criteria will lead to a multitude of interesting, though not prospective, studies on the use of statins and outcomes in a variety of infectious diseases. I do have this ongoing fascination with the non-standard use of drugs to decrease sepsis mortality and infection mortality, including both statins and macrolide antibiotics. It's an interesting literature. See you next time, dudes.